Welcome to our channel. I will be taking you on an important course in pharmacy, pharmaceutics. We will be looking at the ethics of dispensing and presentation of products. Dispensing is the process of preparing and proffering medicine to a named person, patient, based on a prescription. Good dispensing practices ensure that an effective dosage form of the correct medicine is delivered to the right patient, in the correct dosage and quantity, with clear instructions, and in a package that maintains the potency of the medicine. Dispensing is one of the vital elements of rational drug use. Prescribing, dispensing, counseling and adherence. The dispensing process includes all the activities that occur between the time the prescription is presented and the time the medicine or other prescribed items are issued to the patient. What does it involve? The process. 1. Correct interpretation of the wishes of the prescriber. Interpretation of prescription. 2. Assessment of prescription. 3. Selection and/or compounding of medicines. 4. Preparation of items. 5. Supply of medicines in appropriate containers. 6. Labeling of the pharmaceutical products. 7. Provision of information by the pharmacist to ensure safe and effective use of medicines, patient counseling. But for the purpose of this class, we will be focusing only on the first one. Correct interpretation of the wishes of the prescriber. What is a prescription? A formal communication from a licensed healthcare practitioner to a pharmacist, authorizing them to dispense a specific drug to a specific patient. Prescriptions are only meant for pharmacists. The pharmacist is expected to be conversant with medical terminologies. Upon receiving a prescription, the pharmacist should confirm the name of the patient. This is particularly important when dealing with a large crowd of people to avoid prescription mix-up. Cross-checking the name and identity of the patient must also be done when issuing the medicines. Part of a prescription is prescriber information. 2. Patient's information. Below the prescriber's information is the patient's information. This section will include the patient's full name, age, and date of birth. Sometimes the patient's home address will be found here, as well. The pharmacist should also check the date the prescription was written. Name. Name helps the pharmacist to identify the correct patients, avoiding any chance of giving the medicine to a person other than the one it is dispensed for. You also know that patient's full name must be written instead of nicknames or surnames. Age. Age of the patient becomes important in the case of the pediatric, children, and geriatric, old people, cases. Because the dose of drugs in such cases varies, due to their differences in ability to metabolize drugs. Hence, dose of the drugs are calculated based on the age factor in such cases. In some cases, weight and height of the patients are also required. Sex, gender. Sex of the patient also plays major role in prescription because dose of drugs may also vary based on the sex of the patient, as their abilities to metabolize, response towards drugs may vary in many cases. Renal processes of glomerular filtration, tubular secretion, and tubular reabsorption appear to be faster in men compared to women, whether considered on a milligram per kilogram basis or total body weight basis. Address. Address of the patient is generally recorded to contact the person at the later stage or to deliver the medication personally. That is all for the patient information. The third one is date. Date. This contributes in validating the prescription and prevents unnecessary refilling of the prescription. It is of utmost importance in case of narcotics. 4. Superscription. This part of the prescription is represented by the symbol Rx. In the ancient times, it is considered as a prayer to Jupiter, the god of healing, for the fast recovery of the patient. Nowadays it is used as an abbreviation for the Latin term, take thou, which means, you take. 5. Inscription. This is considered as the main part of the prescription order. It contains the names and quantities of the prescribed ingredients. The name of each ingredient is written on a separate line along with its quantity. The complex prescription containing several ingredients, the inscription can be divided into following parts: apis, active medicament of therapeutic action, and excipients. 6. Subscription. This part of the prescription contains directions of the prescriber to the pharmacist regarding the type and compounding of dosage form along with number of doses to be dispensed. This is important because dose of drug also depends on the type of the dosage form. 7. Signa. This part of the prescription contains direction to the patient regarding the administration of the drugs. It is generally represented as sig on the prescription. The instructions may include the quantity to be taken, the frequency of administration, the mode of administration, special instructions. 8. Prescriber signature. The signature and registration number of the prescriber turns the prescription into legal and authentic order to the pharmacist. This helps in preventing the use of spurious drugs. Registration number is of utmost importance in prescription containing narcotic drugs. These are some common terms used in prescription. First is teaspoonful. When you see a prescription containing 1 teaspoonful, you should be able to know it's 5 milliliters. As 1 teaspoonful is equivalent to 5 milliliters. Dessert spoons full 8 milliliters, tablespoon full 15 milliliters, wineglass full 60 milliliters, OD once a day. D twice a day, T, D, S thrice a day, QD 4 times a day, P, O by mouth. This is an health hospital. I've a demo on this. This is the patient's name, age, sex, date and address. Age tells about the gender, how much dosage to give, and route of administration. Here is the RX. It's a form of prayer for the patient to get well soon. Here is the inscription. The name of the main drugs are written here. Here is the subscription. I told you about it. The signature. The option of renewal is written here. The doctor's name and signature is written here. This is a complete demo of our prescription. Hope you understood the video. If you understood the video, like, share and subscribe to our channel. You will keep getting all the videos related to pharmacy here. Bye.